Hi, my name is Katie Miller, and I am a senior nursing student with Illinois Wesleyan University. I've spent the past semester completing an internship on the Peds Infusion Unit here at Broman, and I'm here today to talk about atraumatic care in the pediatric population. Okay, so before we get started, I'm just going to talk about an overview of what we're going to talk about today. So we're going to talk about atraumatic care very briefly, and then move on to talking about comfort positions and potential distraction methods. So comfort positions are vary depending on the age of the pediatric population, and the same thing with distraction methods. Distraction methods we're talking about it specifically in reference to venipuncture today, and like I said, each of those vary depending on the age of the child. So with atraumatic care, the purpose of atraumatic care is to minimize psychological and physical distress experienced by children and their families in the healthcare setting. And so the principles of atraumatic care, the whole purpose of it, is to really prevent or minimize the child's separation from the family. So we really want to provide family-centered care, have the child and the family be as involved as possible in this collective experience for both of them. And then we also want to promote the child's perception of their control in this environment and prevent or minimize their experience of pain or injury. And so why does this matter for the patient? Pediatric patients have rated venipuncture and other needle-associated interventions as the most traumatic part of hospitalization. And so we need to take that seriously and try to reduce pain as much as possible in that intervention. So IV access initiation is something that sets the tone for the rest of that child's particular hospitalization and also their future relationship with healthcare. Children who have had previously traumatic experiences with positioning or IV access for pain are likely going to be afraid in the future. And so if we can minimize that pain, we can minimize that fear and try to build a better relationship in the future with the child and their healthcare. And so we can prevent them avoiding healthcare as adults or even as teens of any age, really. So we can prevent them from being afraid of it and prevent them from trying to avoid healthcare. And so why does it matter for the parent? So it's just as much as it matters for the patient, it also matters for the parent. And parents reported IV needle pain as the second most traumatic part of hospitalization after waiting for their child to return from surgery. So I think that really just goes to show how traumatic it is for parents to see IV access be initiated in their children, and that it's comparable for them to waiting for their child to return from surgery. And so obviously we know that parents care about their children, but there were just some interesting statistics about, I guess, the extent to which they want the pain to be minimized. And 73% of parents would pay more than $15 for their child to not experience pain during IV insertion, and 37% of parents would pay $100 for their child to not experience pain in IV insertion. And 89% of parents would prefer to wait an additional hour if their child were to be in less pain. And so, again, parental anxiety correlates with the child's anxiety. So this is why it's just as important to focus on the parent as it is to focus on the child. If the parent is distraught and really nervous about their child getting an IV, and that's going to make the child nervous and anxious and distressed. So what we need to do is show the parent that we're implementing as many interventions as possible to reduce pain for their child, so that we can not only actually reduce pain in the child, but also put the parent at ease so that the child can be at ease, because there is a correlation between the parent's distress and anxiety and the child's distress and anxiety. So now we're going to talk about how exactly to reduce pain during venipuncture. Maybe. Okay, so best practice is actually to simultaneously use pharmacologic and non-pharmacologic interventions together. So pharmacologic interventions would be like topical anesthesia or like EMLA cream, and so it's recommended to definitely use that before IV insertions, and the floor does a really good job of using that with as many children as possible. And in addition to that, some of the non-pharmacologic interventions that can be used to reduce pain are also performing traumatic procedures in a treatment room, comfort positions, and distraction methods. So the unit already does a great job of making sure that as many traumatic procedures as possible are completed in the treatment room instead of in the patient's room. But today we're going to talk about some additional things that the unit can be doing, like comfort positions and distraction methods. So I think this picture probably looks pretty familiar to most people. It's pretty common in pediatric units in general. Whenever we insert IVs, this is what it tends to look like. People tend to be taking a limb. It takes several staff members to basically pin a child to the table. And in this position, children perceive less control and experience increased distress. And so what we're talking about is alternatives to this position for IV insertion. So comfort positions, the purpose of them is to reduce pain, anxiety, and distress, and then also to increase the child's perceived sense of control, and then also to increase parental satisfaction. And then there is research that this does not significantly decrease IV success, which is a common concern of nurses. So quite a delay. Okay, here we go. So, like I said, the comfort positions depend on the age of the child, and so for infants, it's called facilitated tucking. The pictures that you see here aren't perfect. It's kind of hard to find good pictures on the internet, but I'm going to do some demonstrations also. Basically, the concept is that these apply to infants, neonates, NICU babies, preemies, but we're focusing on infants in particular. So the first thing that we're talking about is facilitated tucking. And so the feet, it can be done in the side, the supine, or the prone position. So if it were to be done on the side, the child would be like laying on a table like this, or and then the arms are supposed to be collectively put together, and so are the feet. And so we're supposed to tuck them all together and hold them like this as the baby falls over. But it's supposed to be done like this. So this would be the side way, this would be the supine way, and then prone would be facing this way, but and you would tuck the feet under too. But obviously these positions need to be adjusted depending on where the IV is going to be inserted. But I think it's just the concept of trying to promote physical touch while the IV is being inserted to reduce pain in the infant. Okay, and then because toddler, preschool, and school-age children are very similar, they're all grouped together. And so there's a lot of variations in this type of comfort position, but basically the main important parts is that they're held by a caregiver and that they're held in upright positioning. If a caregiver, their parent or whatever is not available, obviously this can be fulfilled by a staff member in order to accommodate the child, but upright positioning. So this here would be back to chest. So this is how you would see it in this picture also. So this is obviously a school-age child. This would be a toddler. It applies to both. And so then the IV could be inserted this way if the arm is supported on the table. Excuse me. And then for chest to chest, it could be done this way, and the IV could be inserted in the back if the arm could reach over the table, or it could be inserted in the arm depending on where the IV is going. But this would be chest to chest. And as you can see, that's an older child there as well. And then this is an intramuscular injection, but the positioning is similar, so I decided to include it. And so this would be side. And so if you have the child like this, their arm could be supported this way, and an IV could be inserted there. So these are possible options for toddler school age and preschool age children. So now we are going to move on from comfort positionings to distraction methods. So distraction methods are considered a non-pharmacologic form of pain management, and they can be used during venipuncture. Again, these vary depending on the age of the child, and the mechanism that makes them effective is unknown, but basically it's the concept, of shifting the child's attention away from the painful procedure that they're undergoing and shifting it to something else so that they're better capable of controlling this pain and leading to reduced pain, anxiety, and fear. Okay, so for infants, which are births to 1 year, any sort of physical contact is helpful for them. So you're going to be holding, swaddling, patting, and rubbing them. They don't have object permanence yet, so peekaboo will still be applicable. And then any sort of noise that you can make can distract them. Jingling keys, they have rattles. And then lastly, non-nutritive sucking. So these kind of all like fall into that category. Obviously breast milk would be nutritive, but probably not substantially in this situation. But basically, if you feed the child like oral sucrose, glucose, or dextrose, or put on a glove and then have the child suck on the glove finger, or have them suck on a pacifier, those are all effective means of reducing pain in infants. And then for toddlers in age 1 to 3 years old, again, physical contact is helpful. At the early stages of toddlers, they'll still have object permanence, but that will go away by the time they reach the end of being a toddler. So it will depend on the child individually, as all of these interventions were. Obviously, they're appropriate for like general age groups, but each child is going to be different. So the nurse's discretion is definitely going to be necessary in deciding which of these distraction methods is appropriate. Music and nursery rhymes is another option for this age group. Audio-visual techniques like television, video games, cartoons, things of that nature. Pinwheels, bubbles, stuffed animals, toys, and blankets. So anytime that children have things in the hospital like toys, toys, blankets, think clothing, whatever, bottles, anything that can be brought from home is beneficial to them because it promotes that normalization. So anytime that they can have a new or a toy from home instead of getting a new toy is going to be beneficial for them. They're also interested or distracted by things that light up or move, things that make sound, and then art materials, items for make-believe play, and then oral sucrose is actually still effective in this population in the early years of this age range. And so you can see there's probably some things that are useful in distracting several of these age groups, and so we won't go over them every time, but it just made more sense to include them on each individual slide. So again, holding, bubbles, audio-visual techniques, make-believe play, those are all things that we've seen before with the toddler population. That's also helpful in the preschooler population. So some new things that are here is going to be building with blocks. This population starts to have the capacity to play simple card and board games, so things like Go Fish, dominoes, checkers are a possibility. And then they are interested in puppets. They like to talk about what they know, and they want to show you what they know. So things like saying the alphabet, counting, talking about their favorite things. So those are all things that this population can be used for distraction. And then also stories with books and poems. So having the child show them a picture book while they're undergoing venipuncture can be an effective means of distraction. As you can see also, I wanted to point out that a lot of these methods are cost effective. And so that's really nice because obviously the more cost effective things are, the more practical they are in the hospital setting, considering budget and things like that. So I also wanted to point out that school-age children are the most heavily researched of all the pediatric age groups. There's an abundance of research on school-age children from 5 to 12 years old. So again, bubbles, materials for dress-up or make-believe play, art materials, audio-visual techniques. Those things are all things that we've seen before that also apply in this age group. And then some new things are guided imagery, breathing exercises, kaleidoscopes. Breathing exercises and guided imagery are probably more helpful in the tail end of this population, just from an understanding directions and following directions perspective. Using things like a stress ball or having the child inflate a balloon while the venipuncture is happening. And then this population is also capable of starting to play card games. So they can do things like card games, play video games, board games, search games. And so those things can be played in front of them while the venipuncture is happening as a form of distraction, or depending on where the IV is, if it's possible for them to play while it's happening, that's also a possibility. And then in this age group, they start to do things like puzzles, brain teasers, and distraction cards as well, which we're going to talk a little bit more about distraction cards. These are my references. I know there's a lot of information on these few slides, but I wanted to provide the unit with the means to look into this information themselves if they decided to adopt any of these methods on the unit. Okay, so this is an example of a distraction card. This would be printed on a regular piece of paper. So this isn't black and white, but it would look like this. And then on the back of it, there's a list of questions. And this is the list of questions. So as you can see, they're progressively difficult. So can you find the octopus in the picture? Maybe, yes. So the octopus is over there. So ideally, while the venipuncture is happening, this card is being displayed to the child on a bigger piece of paper, and then parents, nurses, nurses' assistants, anyone really can read the questions on the back to try to distract the child. And so I've created 3, this is just one of the examples, but there's 2 other cards that will be printed and laminated and given to the unit. And I just wanted to kind of explain how they would be used, what age group they're appropriate for, and talk a little bit about them. So the questions that are listed on, if we get there, these questions are just examples of things that you could ask the child, but obviously it doesn't necessarily need to be followed like strictly. You know, like if you ask them about the octopus and then the child loves talking about octopus and wants to talk about it forever, then you know that's fine. But I just wanted to like list possible questions that you could be asking for a means of distraction. And then in addition to that, I also will have 3 posters will be prepared for the unit. So the distraction cards will be given to the unit, and then we'll also have a poster summarizing the information on comfort positions and also summarizing the information on these distraction methods for the treatment room. So I think that's pretty much it. I just wanted to thank everyone for their time in listening to this presentation, and also their time in helping me get the hang of things on the unit throughout the semester.